Okay, today this video segment is going to cover an IV insertion. The equipment you will need is an IV start kit, an extension set, an IV cathetron or catheter, and your normal saline solution. We're going to expect that you verbalize that you have checked your orders, that you have washed your hands, that you have identified your patient, and that you have explained the procedure to your patient. So first thing you're going to do, once you have done all of that, is go into the room and see if you can find a vein that you want to use to start your IV on. You'll pull out the tourniquet and you'll place your tourniquet. You can refer to the other video on tourniquet placement for how to actually put a tourniquet on properly. So I'm going to put my tourniquet on, allow the time for the veins to engorge. I will check for veins that look good. I want to start my IV as distally as possible first and then work my way up the arm. After I find a vein, I then pop my tourniquet and I can get my equipment together and get that ready. So I'm going to open my extension set and flush that with normal saline. So I will open it, trying not to touch the tip of the extension set. If I do touch it, I can of course wipe that down with alcohol. So I can open my saline. Then I want to flush with just a small amount of saline. It doesn't take much. You can see it go through the tube. And then I can set this aside for in a minute when I get ready to use that. I'm going to go ahead and open up my cathetron. Have it ready, and then I can get my cleanser, locate my vein that I'm going to use. You open the ampule by just pressing it and cracking it. The chloropleth will go into the tip, and I'm going to start my IV right here. So I'm going to work from the inside out, cleaning that and then allowing it to dry. While I'm waiting on that to dry, I can go ahead and initial, date, and write the gauge of my needle on the dressing that I'm going to use and have that ready. I can go ahead and put my gloves on. My gloves come in as a sterile set, but they do not have to be put on like sterile gloves. And if these gloves in the package do not fit you, feel free to get a pair of non-sterile gloves that do fit you. So after I have that on, then I can reapply my tourniquet. Get my vein ready. Okay, so once I've got my tourniquet back on, I'm going to come back down here. I need to wait for my chloroprep to dry. Once it is dry, then I can get ready to actually start my IV. You want to look at your needle, make sure that it is no burrs on the ends, everything's nice and sharp, that the flange is up. You never want to touch the blue part of your cathetron. The flange is what you use to push the plastic catheter part into the vein. So you're going to find where you want to start, apply counter pressure, and then once you actually get ready to insert, you puncture, guide it into your vein, wait for flashback. Once you get flashback, you want to pop your tourniquet, and then you want to guide the plastic part of the needle into the vein while pulling back the needle until it's all the way up to the hub. You click it into place, and then you steady that and watch it. Never take your eyes off that. Then you can actually stabilize it with your Tegaderm. And we know that's stabilized on there. Whole time you can talk to your patient, make sure your patient knows what's going on and that they're tolerating everything okay. There. Now I want to get ready to disconnect my needle from my hub and connect my extension. So I want to loosen the cap of the extension, have that ready. I want to never take my eyes off that, make sure I do not touch or contaminate it. Estimate where the end of my plastic cath line is. I want to apply pressure at that point to try to stop some of the bleeding. Hold pressure and stabilize my catheter at the blue hub. I can touch it now because it's covered by the tegaderm. Take that, I remove the needle, insert the extension set, and then make sure that it is screwed on there tightly so that it does not come apart while you're stabilizing this on your patient. And remember, that could be painful for them, so you want to try not to move it too much. So at that point, once it's in there, I'm going to pull back and see if I get blood return, and then I want to actually insert 2 to 3 cc's of saline. When that goes through, then I can actually remove the extension from my saline, and at that point I won't need that anymore. Now I need to stabilize my IV. I want to do a chevron first. Remember, do not put your tape on the bedside table, your scrubs, anything like that. You want to move and manipulate this just as little as possible. You slide that under and then you cross it. There are a couple different ways to do chevrons. You can do whatever is most comfortable for you. If you chevron it and then you stabilize up higher, you want to make sure that you do not cover the insertion site or the vein with any tape. You can go ahead and clamp your extension tubing so that you can create a positive pressure. And then you want to stabilize, take down your extension tubing so that it is not moving around. Then I can get my label that I filled out earlier and apply that to my patient as well. I've got my IV started.